just coming up online, streaming live to you, called the Family Awareness Meeting. And we are talking about living with bleeding disorders and understanding the impact that your family can have, your community, and the people around you, to helping you live really a better life, successful life with a bleeding disorder. And so, really excited to talk to you about that today. We have some amazing prizes and giveaways that we're doing at this event. It is going to be so much fun, but you need to go to our website and register right now for April 27th and 28th. This is a live online seminar. You got to attend live as it's streaming. And when you go on this event, we'll send you the links for Zoom, and you can get into the break sessions and learn more about this exciting weekend. A lot of really important topics. We're even talking about needle phobia. We're going to be talking about how no one is really alone when it comes to a bleeding disorder. No one's truly undiagnosed. And so we're going to be talking about all kinds of great things, but we're giving away a $500 gift card each day if you attend 3 or more sessions. We'll enroll you in a raffle for that. We're also, in each and every session, we're going to be giving away a $25, $50, or $75 gift card in each one of those. You don't want to miss that opportunity. It's going to be a lot of fun and a lot of great time together and learning, meeting more people from around the community all over the United States. People will be joining us in this live session, and it's going to be a really great time. I want you to be there, and I don't want you to miss out on this great event. But I want to invite a good friend of mine, Andy Matthews, who is a patient himself, and he has been around the community for a long time. And Andy, I'm going to bring you into this call today, but it is great to see you. Thank you so much for joining me for the pre-event podcast.
Awesome, Jonathan. Thanks for having me.
Well, you have been an inspiration to me and so many people in our community, because when I think about hemophilia family, you are included in there in the top of all of my family, as I have many aunts and uncles and my sisters and other people that are surround me that kind of made up part of my support system. You've been such a close friend and like family to me for many, many, many years. And I can't help but think about this conversation that we're having about family awareness and how important that unit is, that support system is. And but man, there's some people that are tuning in right now. They've never gotten a chance to know you. And so why don't you tell us a little bit about where you're from and how you're impacted by a bleeding disorder, and tell me a little bit about what you think about this meeting coming up.
Yeah, I'm from, right now I live in Waco, Texas, but I'm from Corpus Christi, Texas, which is interesting in the sense that when I grew up, I had no support group at all, other than one other family who the young man's passed away since then. But me and him were the only guys in Corpus Christi that had hemophilia. We did go to a summer camp that was sponsored by more of the chapter up in Dallas once a year, but that was the extent of my support. There was no, I didn't live in Dallas, so the chapter wasn't really much of a part of my life. So what people have here at Hope is awesome. Any young parent today will do much better than we did, because we were just kind of slow to learn things because we just kind of learned them on our own.
Yeah, it's true. You've always been such a big advocate for people getting involved in the community and getting to know other people. I know that some of the things that we talk about behind the scenes sometimes might not be what you might talk about in the clinic even, but how important would you say is it to having friends in the community that really understand what it's like to live with the same bleeding disorder as you?
I mean, I just say, if you want to be successful in hemophilia, meaning if you want to breeze through it, whether you're a young man, whether you're a father or mother of a young child with hemophilia, whatever, if you want to skate through, the world of hemophilia fairly easily, you got to get involved. It's just like anything. If cars are your passion, are you going to be involved in some car clubs? And sure, same thing, whatever your passion is, or your church, if you want to be involved and get plugged into your church, you got to be involved. Same thing with the hemophilia group. If you want to learn more and know more, there's no other better way than to talk to other people with a bleeding disorder and find out what they're dealing with, what products they're on, how it's working, what issues they have. It's just you get in a room full of other people with hemophilia, you're going to learn 10 times more than is out there, plodding along by yourself. So I think it's extremely
So
important,
true.
especially in the early
That's
years.
so true.
But as you get older, you got, like I have, me and Jonathan have things to give back. We don't need to learn as much other than we want to give back. Of course, in today's time, there's constantly stuff we're learning because there's new products. Just make my head spin. How fast things are changing even today.
That's so true. There's a lot to learn, but I find even as it seems like every year that goes along, I'm having to face new health challenges of my own, like getting a colonoscopy. It's like, what do you do, Andy? I mean, there's certain things that happen or heart problems. I mean, man, I didn't have some of these issues 10 years ago, but now I'm having to juggle some of those things. So it's always good to have a friend. Tell me a little bit about your family. I mean, you've had a lot of family members and you've had to juggle sometimes helping them understand your bleeding disorder. I mean, I think about you, and I've had this conversation a lot through the years of how, even if you're just in the car or going on vacation, like it's kind of good for them to have some kind of basic information about what you need if you were in a car accident or something like that. How important would you say it is to have your family also know a little bit about your bleeding disorder?
I take it you're talking about extended family, kind of more or less.
Yeah.
Yeah. Oh, I think it's important. I mean, I think if you're like me, you decide who is kind of worth trying to, because most people know nothing about hemophilia. So, the people that I'm around the most, generally speaking, I try to, I need to keep doing that, keep talking about hemophilia, maybe the new products I'm on, my cousins, the people that I see 2 or 3 times a year. I think it's important. The very extended family, it's kind of you use your own judgment, but sometimes you go to family reunions, it's a good place to bring up hemophilia. People always find it interesting because why? You're the only one that they've ever heard with that has hemophilia, and so I usually have never found anybody that doesn't want to hear about it because they just find it fascinating because they probably the first time they've ever heard about it.
Yeah. One of the things I find in the community today is because better extended half-lives, different kinds of things are happening now. And it seems like I remember as a kid, it was like there was so much trauma involved with going to the emergency rooms and having to deal with IV infusions and different things that you were having trouble with that you really needed a lot more support, I think, than you do now, where things are a little bit easier. They're not quite as frequent as you used to have to do. So people, there's this concern I have in the community where I feel like that people are not, they're not needing to get as much education as we once upon a time did. And that was really because mostly the trauma itself is kind of absolving, which I'm super thrilled about. But, I wonder sometimes like how important it might be to really, I do worry about, our generation had a lot of friends. We had a lot of connection. We had a lot of people, but now it's almost like I want to live my life and I don't want anybody I know to know that I have this thing that I have to live with. And I'm concerned about that. I feel like that it really, some of the benefits, some of the best way for me to learn how to advocate and speak up for myself was by me telling my people, my friends, my family members that didn't have hemophilia or they didn't have any association, like learning how to communicate that elevator speech was really valuable to me, even being able to sometimes even ask for what I needed at the doctor. Right.
No, I do. And I find I have a friend that helps me out at my ranch, and big old strong strapping guy. And he helps me do a lot of things that I can't do or don't want to do or whatever. And I find myself in conversations with him quite frequently when we're just out working, talking about hemophilia or HIV or hepatitis C. And it's a neat talk because guys like that have never heard about anything in hemophilia, everything you tell them just blows his mind. Well, I thought such and such was this, or I thought HIV was contracted this way. I thought hemophilia was this. And so I'm a firm believer in that, especially the people that you're friends with or you associate with quite a bit. You need to talk to them. I was dealing with a guy that at my place that was in a pretty bad 4-wheel accident a few months ago. And here I have hemophilia and I'm helping him. But it's good that my friend knows that I have hemophilia in case that was me. He would be able to know if I was kind of conked out like this guy was, he needs to know a little bit about hemophilia in case he needs to talk to the EMS people, which I had, this is one of my first times experiencing this. And so it was kind of rather eye-opening to me of I need to keep doing that.
Yeah, that's so good. I do think that it really helps our language a lot to develop if we're trying to explain to people who have no reference point.
Mm-hmm.
And I would encourage anybody that is dealing with that. I know even for me, one of the things that I went through when I was in college was that looking back, a lot of my friends from college would say they didn't even know I had hemophilia until I was probably in my mid 20, 25, 30, somewhere in there, because I started to have a lot more joint damage and issues. And so then it was kind of a surprise to them. And some of my friends even came back on a personal level, just said, "Hey, I just want you to know, like, I care for you. You're my friend. Like, I was really disappointed to know I didn't know this side of your life. And I wanted to know so that I could help if there was something going on." And, it kind of felt like they wanted to know. And so that really was a eye opener for me, where I started to become a lot more confident in saying, I don't wear it on my sleeve, or, just every person at the grocery store doesn't know. But, the people, like you said, that you spend time with, I think it's important that we get better at, helping the people around us that spend time with us, like you said, for in the event of a car accident or something else, or if you just, can't you end up in the hospital because of some unknown thing. It's a good thing for them to at least be aware that this is something you live with, right?
And I live in a smaller town, and I go to a treatment center in a bigger town. But where I live, if I needed immediate medical attention, they don't know anything about hemophilia. So I try to talk to all my doctors, and whenever I'm going in for another colonoscopy here soon, I'm going to try to keep educating my whatever the doctor is that deals with that. I'm blank on the name, but when I talk to the emergency room staff, when they're putting you to sleep, they usually ask you something. So I try to, throw little plugs about hemophilia just for education. They find it, fun to talk about, because it's the first time they've ever, most of the time, heard about it. So you're right. It's a very good experience for anyone, because the audience is usually more than willing to listen. So
I would say too, a lot of folks that out there, I know from Hope's perspective, we're helping people every day with resources and financial assistance, and helping people get through the difficult times in life. And one of the things that I've observed over and over and over and over again is that people that have a strong support system, and that could be your blood family, it could be just your friends, it could be your church or community, it could be anyone it could be part of the hemophilia community. Anybody that has a strong support system usually fares a lot better when they go through difficult times than somebody that doesn't have a support system at all. And unfortunately, we have seen so many people in the community. I mean, you've seen some of these folks too. It's like, I'm blown away at sometimes how many people just don't have a very strong support system. And part of that is, I always say, you need to build relationships in peacetime, because you need to lean on those relationships in wartime. And I think sometimes in our physical state, when we're in a lot of trauma, that's when we need people to lean on. But if you haven't invested in those relationships in peacetime, you don't have as much to lean on, right?
Yeah. And also, I want to add, I hear this so much from my patients that, if you learn to do this on a frequent basis, and you learn to talk like an expert, hemophilia expert, almost like a doctor, okay? You only get that by practice. You will find that when you're talking to your physicians, i.e. going to your dentist, I hear this all the time. Well, my dentist is scared to deal with me. I'm hemophilia. I can promise you, the reason your dentist is scared to deal with you is probably because you have not come across confident that whatever he's going to do, you're going to be okay. Or I go to a primary care physician, and if I didn't have a good hemophilia treatment center, I wouldn't have a problem at all of him writing my factor script, whatever. Because every time I go in and talk to him, I tell him a little bit more about hemophilia. Not that he'll ever be a hemophilia expert, but he could, get me out of a bind until I could get to, a treatment center or something like that. So, but you only get there by routinely talking about it. Then the physicians will see that, oh, okay, well, I'll write for, or do whatever you want to do? Because Jonathan, he sounds confident. He knows what he's talking about. So I'm confident. I can take care of him during this dental extraction or just teeth cleaning. I mean, I hear it all the time, and it's almost always that the patient doesn't know how to eloquently talk about what's going on, that his physician shouldn't be nervous. It's usually a minor procedure, but you got to learn to make them feel confident. Otherwise, it's going to put you through a lot of ringer. They're going to send you another doctor. And, if it's something that getting a simple dental work done, they don't need to be dentists that know much about hemophilia. You just tell them, what the deal is, and they'll listen and be very receptive. I've never had any doctors like that just freak out on me.
Yeah, that's so true. That's so true. Well, some people might not know this, but you actually are a huge resource in the community, not just on the personal side of living with a bleeding disorder, but you also work for a specialty pharmacy and help people make sure that they get their medications on time. You have done so much advocacy with insurance policies as well as with physicians and helping them make certain that they don't lose touch with that. How important would you say that having a strong relationship with your pharmacy or pharmacist is so important as a part of your core care team?
Oh, I think it's very important. I always say the people that are educated and know who to talk to in their pharmacy. I work for Specialty Therapeutic Care, for instance, and if the people that know, I tell them, call Martha or our insurance or whoever. But if they get to know them, or if they have a problem, pick up the phone and call me, Andy. I'm not getting such and such. Can you help me? But if they're not going to reach out at all, sometimes they're just invariably things have hiccups in them, and therefore their medications are delayed to this and that. But if they're very proactive with their pharmacy, generally speaking, they get what they want. But in today's time, it just seems like nothing goes as smooth as it did in the old days, just because there's so many moving parts in the wheel to actually factor out to a patient versus getting the script into the pharmacy. There's lots of things that happen.
Well, and that's one area that you've become really an expert, either by default or just because I know it's been a huge area of interest for you. But insurance is one of those things that's very difficult to navigate, and you've become quite an expert in just knowing how to untangle some of those really extremely difficult insurance issues. And I don't think that's possible to really. Sometimes it's not what you know; it really is who you know, right?
Absolutely. In the world of insurance, there's things that I'm learning all the time, and even in my own company. But patients have got to find out who their experts are in the insurance world and lean on them, because there's no way, if they don't do it for a living day in and day out, that they're ever going to. Sorry about that. They're ever going to learn, the stuff that I know, because I deal with it every, day in and day out. So absolutely. Right. I can't emphasize that enough.
Yeah, that's so good. Well, I know you're a popular guy, which is why you're getting phone calls.
That's a total telemarketer.
It's your good friend spam.
I'm the only one in the world that still has a landline. So
that's great. Well, I'm really excited about this event coming up. I know you're going to be hanging out with me and a bunch of other folks in the community. One of the things I always encourage people to do is come to these online seminars, because it's a great opportunity for you to it's a light way for you to be able to get to know other people that are around the country that are involved with living with a bleeding disorder. It's a great way to educate your friends, your family. I always encourage, bring your aunts and uncles, bring your neighbor, bring somebody that actually is part of your core support system that you might live with day in, day out. And I promise you, sometimes people say it's kind of a chicken or the egg thing, but I'll show you somebody that has a goal, and I'll show you somebody who's more successful, somebody who doesn't have a goal. And it's really important, because if you educate yourself and make yourself more aware and bring the people with you that are in part of your everyday life that need that education too, a lot of times that will make you a much stronger advocate for yourself, but also it'll help improve even other parts of your life, right?
Absolutely. Absolutely.
Well, I'm excited to see you there. I think this is going to be a great event. It is April 27th and 28th. It's going to be live streamed. You need to get online and register so you can get all of the Zoom links, because this right here, this podcast obviously is going out on social media and all kinds of channels, but the actual event itself will not be going that way. So you need to get involved in getting online and get that the links emailed directly to you so you can be a part of it. But Andy, thank you so much for joining me today on this pre-event podcast, and I look forward to seeing you very, very soon.
Awesome. Thanks, Jonathan.
All right. Man, it is a treat to be able to hang out with that guy. I always seem encouraged and inspired, and I'm looking forward to a great event. I think we're going to have a lot of fun at this coming event, and I really want you to join me and be a part of it with me. As I mentioned earlier in the session, that this is going to be April 27th, 28th, live stream. Don't want to miss out on this great event. We're going to be giving away tons of prizes and giveaways. You're going to have a lot of fun. Every session, $25, $50, or $75 gift cards given away. We're also giving away a $500 grand prize, but the details are in the registration. So go register right now. And if you know somebody that's living with a bleeding disorder and they're not involved, go rope them into this too. Send them a text message right now and send them this link and tell them to get online and get involved with us. We would love to meet you. We'd love for you to be part of our family at FAM Education Online event. And we want you to be able to support that they need through their journey too. So thank you so much for joining me on this podcast. And I look forward to catching up with each and every one of you very soon. But for now, we'll see you soon. Go register and we'll see you on the 27th, 28th. Take care.